Ladies and gentlemen, good evening. My name is Deliwe Sicholwane. I'm the first year student doing my BTech. It's my first year doing my BTech in HR management, human resource management. And what I'm about to do a presentation on COVID-19. As you can see, I had my mask on and my face was also covered. But just so that everyone gets clarity, I'm gonna do the presentation without a face mask. And this is a short presentation that will be about 20 to 30 minutes. And the topics that I'm going to cover during this presentation, I'm going to cover about 6 topics, of which one of the topics is what is COVID-19? We're going to cover also the national statistics. We'll cover the main types of COVID-19 infection. We cover stages and symptoms of COVID-19. We look at the ways of preventing COVID-19 transmission. And also, lastly, we'll touch base on what do you do if you are infected. So, firstly, let's go into the first topic, which is what is COVID-19? My understanding, and this is a pandemic that most countries are facing during this time. So we need to understand what it is. What is COVID-19? So I found one definition where it explained COVID-19 as a mild to severe respiratory illness that is caused by coronavirus, and it's severe acute respiratory syndrome, coronavirus 2. It is transmitted chiefly by contact with infectious material, such as respiratory droplets, or with objects or surfaces contaminated by this virus. So that's what this virus is, because it's got to do with the lungs, and it's a respiratory illness. Now we go to topic number 2, which is we're looking at the stages and the symptoms of COVID-19. What are they? So we're going to start looking at the stages. What stages are COVID-19 for COVID-19? How do you feel, or what stage, what you go through when you're about to have, or when you have been infected with this virus? So you may start feeling achy, that you have an achy body, and you have fever, and you will have chills, or you become nausea. And then we look at the symptoms. What are the symptoms? One of the symptoms is fever. You will find difficulty in breathing, or you might experience shortness of breath, and you might have chest pains, or you have pressure. You might have funny or severe headaches, sore throat, diarrhea. You might even lose your taste or your smell. It depends, because these symptoms, they vary for patient. So not everyone goes through the same. And there are also people who do not show any of the symptoms, who have no symptoms, but yet those people have tested positive to coronavirus. And then we look at the main types. What are the main types of COVID-19 transmission in South Africa? So this virus spread direct with the contact with respiratory droplets from one infected person. So if one person is infected and you have been in contact with the respiratory droplets from that person, then you might that's a main type. And the cough and the sneezing can spray the droplets onto other people or surrounding area. And if these droplets, they enter your mouth, they enter your nose, or even your ears, you can become infected. And then we look at another topic, ways of preventing COVID-19 transmission. How do we prevent it? So you can either have a hand wash, antibacterial soap, because number one, we need to wash our hands regularly and thoroughly. That is very important. The washing of the hands regularly and thoroughly, using either a hand wash or you use your antibacterial soap. Secondly, you do not touch your face. Try to avoid touching your face at all times. Thirdly, you cover your mouth. Whenever that you sneeze or you cough, make sure that you use your flexi elbow to cover your mouth. And you sanitize. After you have washed your hands, make sure that you use your sanitizer. Your hand sanitizer is very important. Try to find a hand sanitizer that contains a high percentage of alcohol, because that will definitely kill the antibacteria. So the one that I currently have, it's 60% alcohol, which is quite good. If you can get it to 90 or 70%, perfect. So another very important thing, just to make sure that you wear your mask at all times. And it is vital that the mask is worn correctly. You make sure that your nose is covered. While still on our mask, we must just make sure that we do not share our mask. Make sure that you do not share your mask. Another important point that we're going to cover is what do you do when you are infected? When you are infected, when you got your results and your results come back that you have tested positive, you are infected with the virus, COVID-19 virus. So you just make sure that you stay at home. You do not leave your home. You do not go to public areas. You stay at home. Make sure that you only go out just to get your medical care. If you have medication that you need to collect from the pharmacies, and then, or maybe from the clinic, that's only the time that you go out. You don't visit public areas. And when you do go out, make sure that your mouth is covered, you have your mask, and you make sure that you have your sanitizer. Try to carry that at all times. You isolate yourself. That's point 2. Isolate yourself from other people and also from your pets at home. Number 3, take good care of yourself, meaning that you must try to rest as possible as you can, and you stay hydrated, meaning that drink lots of fluid as you can. Make sure that you drink your vitamin C, you eat your oranges, you drink plenty of water. And then number 4, you stay in touch with your doctor. Should there be any other complications, or you notice that you are developing new symptoms, you're not getting better, you call your doctor or you call your clinic before you go and visit them. Just make sure that you do let them know that you're coming through, and be honest that you have tested positive. And also try to avoid using public transport when you are infected. As much as that, I know that most people, they don't have their own cars, so they rely on public transport. Try by all means to avoid using public transport, and also try to avoid the sharing of ride. I know that people do give each other lifts going to work, but try to avoid that. And also we look at the monitor your symptoms. Make sure that you monitor your symptoms. You might develop new symptoms, and not everyone have the same symptoms. Each and everyone is different, and everyone develop different symptoms. And then lastly, but not least on the topic, we on this COVID-19 presentation, we look at high-risk population of COVID-19, who is at high risk. And so I'm going to be covering that as well. The virus infects people of all ages, that we know. But however, evidence to date suggests that the 2 groups of people are higher risk of getting severe COVID-19 diseases. which is the physiopedia.com. That is my source. So those two groups is the people that are older than 60 years old, our senior citizens, and people with serious chronic illness. And those illnesses include diabetic, cardiovascular disease, chronic respiratory disease, cancer, hypertension. So those two groups of people, and the chronic liver disease as well, those are the people that are on high risk. So that is why that when they go out to do the shopping, it is always advisable, especially retailers, advisable so that we help them as quick as we can so that they can go home, because they are among the high group people that are highly to be infected on a high risk. Those are high risk people, high risk group. And I think that's about it. And I really hope that by this presentation, it's a short presentation, by this short presentation, we have learned something. And what is important is that we need to adhere to the COVID-19 regulations of social distancing when we're in the public, meaning that we need to keep 1 meter apart from each other. We need to make sure that we wear our mask at all times. And also, very important, that we also teach our children at home. And I think that we have done that job, because we will be surprised how formative they are. I've got a 6-year-old Kayone who can tell you what COVID-19 is, what you need to do to prevent it. And even though that at the beginning they didn't understand it, but now they understand, they understand the importance of washing your hands. And you don't just wash your hands, you wash them regularly, and you make sure that you use your hand soap, or you use your soap, the antibacterial soap, and after you've washed your hands, you must sanitize. So if only that we can join hands together and take this disease seriously, as it has claimed so many lives. People have lost their loved ones. If you don't know somebody who has lost a loved one during this time to COVID-19, meaning that you don't have a better understanding of it. But once that you socialize with people, or you know people that have lost their loved ones, then you start taking it seriously. Because to be quite honestly, it's so sad when you go to other places, you see that there is no social distancing that is being maintained. There is no wearing of the mask, and there is no lockdown in actual fact. Because as we are in level 3, you'll find that parts of the towns or part of the areas, they are taking lockdown seriously, and then you go to other areas where they don't. So if only we can join hands and take this virus serious, definitely we will flatten the curve. Because I doubt very much, when we look at the statistics, when we look at the daily statistics that is being released, I don't think that we have done that, we have flattened the curve. But God's willing, we will beat this. People have lost their jobs. So many businesses have closed, so many businesses are retrenching, and together we can. And I believe that once everybody is in the same understanding, same way of thinking when it comes to this virus, and then we will definitely beat it. Once again, my name is Deliwe. My surname is Sicholwane. I'm a BTech student, first year student of BTech at Cape Town, CPUT, and I'm doing my HR. And fortunately, one day, this will pay off. Thank you.